مسئولیت برنامه‌های ارائه شده و تبلیغاتی که از تلویزیون عصر امروز پخش می‌شود به عهده برنامه‌سازان و صاحبان آگهی است و این تلویزیون هیچ گونه مسئولیتی را در این زمینه نمی‌پذیرد.
Hello, I'm Dr. Foojan Zeine and welcome to Inner Voice Show. On this episode, we're going to talk about relationship, finances, and a whole lot more. So stay tuned. Hi, I'm Dr. Foojan Zeine. I'm a psychotherapist. I'm an author and an international speaker. I have hosted my own television show, Inner Voice, in a satellite program for 16 years. Whether it's premarital counseling or through their marriage, how to deal with children, and if they're going through a divorce, to teach them how to communicate better together. In actuality, I think my job is very important to work with individuals and the couples in order to make the most important relationship of their life healthy, which makes them healthy. On my Inner Voice show, I actually interview some of the prominent psychologists and entertainers in English, and I also speak to some of the psychotherapists who are Iranians and the artists who are Iranians, and I speak in Persian to the Persian population around the world, from Iran or Europe or Japan, Australia, all over the United States and Canada, because obviously I was born in Iran.
Where's Dr. Zeine? Dr. Zeine?
Hello.
You also have been trained in my specific methodology and techniques, correct?
Yes.
Are you willing to talk to her after this show?
Absolutely.
And tell her the step-by-step that she needs to do to deal with what I believe is an addictive personality?
Yes, absolutely. The family goes through a lot. For boys who are becoming girls, the fathers of the family suffer. They will keep being confused. They look at all the childhood pictures that they've took of their son, and now they look at somebody who's standing in front of them and supposed to be their daughter. Coming up, I'm going to be talking to a psychotherapist about awareness integration model. You really want to know what that is, huh? Coming up. Stay tuned. Hi. I'm Dr. Foojan Zeine, psychotherapist, and I'm here with Nasreen Bafordari, licensed marriage and family therapist. We're going to talk about awareness integration model, a psychological model that I have originated, and Nasreen Bafordari is one of the first therapists who has actually learned and has been utilizing it with her clients. Thank you for coming.
Thank you for inviting me. This is an honor.
Some of the major topics that I actually talk to my clients who are couples are first talking about sexuality. Many people don't know how to talk about sex. Concept of communication about it is something that I actually have to teach the couples and how to do. We talk about sexuality. Many people come into their sexuality in a very automatic way. We can go through the whole experience and wham, have a great time, but being with another human being, it actually takes skills. So becoming aware of every area of how we think, how we behave, how we feel, how we communicate with another human being in order to have an amazing sexuality is part of what we also teach in this AI model.
So much of our sexuality.
People don't talk about finances a lot. They don't have a system. They come from two backgrounds of how they actually have created their finances, and I have to help them create a system and have a great communication in how to follow the system. Another main topic is when they actually have children. Now remember, two people, two backgrounds, two cultures, two sets of values are coming in, and now they actually have to bring those together, and that's where they need how to communicate, be flexible, and really negotiate on one way of handling their kids. Duet, sometimes you guys are entering each other's space and singing together, and then solo. How does that experience for you?
The funny thing is,
in-laws, we have to deal with them. They're always there. They're going to be there. We didn't marry them, but they came with a package. So somehow we have to really, really work with it. And if I have to actually add one more topic that I've had to deal with a lot of couples and individuals, is addiction. Whether it's an addiction to alcohol or drugs, pornography, cell phone, computers, is one aspect that really, really affects the person's life and in their relationship. With people who are going through recovery from addiction, they've had some sort of a trauma in their childhood. And when we've worked with the awareness integration model with them, clearing the trauma, the choice and the chance for them to relapsing is really minimized. I have been in the field of psychology for about 25 years. I started with seminars in ontology and psychology almost the same time. And I know you were part of the pilot study that we did, and in the result of that pilot study was that people were actually minimizing the depression 76%. They were minimizing anxiety 64%, and their self-esteem was rising about 43%. Now those are astonishing numbers.
You know, I wanted to go through it. I wanted to experience what my clients would experience. So I asked you to work on me as a model for the group that was being trained.
Hey everyone, thanks for watching. If you like what you see, you can see more on my website and my YouTube channel. And if you want to contact me, I'm on Facebook and Twitter. Bye-bye. Hello, I'm Dr. Foojan Zeine, and welcome to the Inner Voice Show. This is the show about what you like and what's important in your life. And I have the privilege of speaking with many of the prominent psychologists around the world. And if you want to see other interviews with the different psychologists that we have, please go to the YouTube channel that you see on the bottom of the page and look at all the interviews that we have. I think I have the privilege of hearing many of these wonderful psychologists, people who create theories and are established in different types of theories, and we get to hear them as therapists, but now I've got the privilege to bring them to you. And today I'm honored to have Dr. Christine Padesky with me. Let me tell you a little bit about her before we get to talk to her, actually. Dr. Padesky was voted the most influential. Hold on. Dr. Christine Padesky, let me tell you from before, is considered one of the leading cognitive therapy presenters in the world, appreciated for her depth of knowledge, compassion, and warmth. That is so true. She is such a warm and kind person. You'll meet her in a minute. She has presented over 400 workshops to more than 50,000 professionals throughout North America and Europe, as well as 25 workshops with cognitive therapy founder Aaron Beck. She received her bachelor's from Yale University and her PhD from UCLA. She is the co-founder of the Center for Cognitive Therapy in Huntington Beach, California. Dr. Padesky was voted the most influential international cognitive behavioral therapist by the British Association of Behavioral and Cognitive Psychotherapies. In 2003, she got the Distinguished Contribution to Psychology Award from the California Psychological Association. In 2007, she was the recipient of the Aaron T. Beck Institute for Cognitive Studies Award for Excellence in Contribution to CBT. In 2009, her book, Mind Over Mood, chosen for the inaugural Book of Merit Award by the Association of Behavioral and Cognitive Therapists. And she's a featured therapist in 3 award-winning educational films. She's a co-author of 5 books translated in 23 languages: Mind Over Mood, Clinician's Guide to Mind Over Mood, Cognitive Therapy for Personality Disorders, Cognitive Therapy with Couples, and Collaborative Case Conceptualizations. Dr. Padesky, welcome to my show.
Thank you. It's my pleasure to be here with you.
I've been in many of your workshops, and I've been into associations where you have lectured, and I've definitely learned so much from you, especially about cognitive behavioral therapy. Now, you consider yourself a cognitive behavioral therapist, so tell our audience a little bit about what do you mean by cognitive behavioral therapy?
Well, cognitive means thinking.
and behavior means what we do. And so cognitive behavioral therapy is all about understanding how our thinking and our behavior interrelate with our moods. And in particular, the way I like to say it to people that I work with in therapy is my role as a therapist is to help people figure out what are the smallest changes they can make in their thinking and behavior that will lead to the biggest positive effect in their life.
Now, your book is Mind Over Mood. So when we're talking about cognition and looking at how you think and how you think affects how your emotions are, so the title Mind Over Mood is perfect. Now, I know that the first edition sold over 1 million. And why did you need to write that book? What is in that book that for the audience they really need to know about so they can get it, and how is it going to be helpful for them?
Well, it's interesting. We ended up actually writing the book because we realized that everybody has lots of different moods during the week. We feel sad, things happen, we might feel sad for a few days, and we normally have lots of things we do to handle and manage our moods. So if we're feeling sad for a few days, we might call a friend to get ourselves cheered up, or we might decide to go out and do some things that will lift our spirits, or watch a funny movie. If we're feeling anxious about an upcoming talk that we have to give, we might prepare and practice until we feel confident we're not feeling anxious. But for a lot of us, we have times in our life where our moods get so big that those simple practical things that we're used to doing just don't work anymore. And many people throughout the world, when they do get depressed or they're anxious, the only thing they think of that they can do to help themselves is to get medication. But in fact, over the last 20, 30 years, we have learned that there are many skills that people can learn that will help them manage their moods more effectively. And so we wrote Mind Over Mood because we didn't want people to have to always go to therapy to learn those skills, but instead so that they could, at their own pace, read a book and learn about these skills and master them and put them to practice in their own life.
And as you have found with your clients, patients, what is it that at times contribute to some of these moods and emotions that are so overwhelming that we cannot take care of them, versus some of the emotions that come up that we have the skills? Such as, I know that with many of my clients, when I work with them, there are certain day-to-day things where they've got the skills. Maybe they learned it from their parents and the environment that they learned, or they learned it through their own experiences. But there are certain emotions that are there, and they can't, like you said, they can't get rid of it, and then they need other skills. What is the difference that you have found between these types of emotions that comes up for people, where some of them they are able and some of them they're not able to take care of?
Well, that's a really good question, and there's actually multiple answers to it. Sometimes
I love to hear them all.
Sometimes it's that we're fine dealing with feeling sad or feeling down or upset or angry for a period of time, and we can work it through. But then sometimes we have periods in our life where things just pile up and pile up and pile up, and we can handle one problem or burden and we can handle the second one, but by the time the third, the fourth, and the fifth come along, we get worn out, our resilience gets worn down, and then we can become quite depressed. Another way the thing that can happen is sometimes people get ill, or they actually have biological shifts within themselves. A common thing we know of is many women, when they go through hormonal changes related to having a hysterectomy or going through menopause, or a teenage girl who's first going through puberty might be having a lot of hormone changes, and these can lead to effects on our mood. Sometimes we have a traumatic experience in our life, and through a trauma of being very hurt or abandoned by someone, or through a trauma like a car accident or an assault, that can lead to a change in our moods and all of a sudden become too overwhelming for us. Other times we might grow up with certain fears that we don't have to face, but then we get a new job, and we have an example in the book of a woman, Linda, who functioned very well throughout her life, but she always had a fear of panic attacks and airplanes, and she could kind of put these at the side of her life until she got a job promotion, and then all of a sudden she was expected to travel more by airplane, so all of a sudden she couldn't shove her anxiety aside, she had to deal with it.
And when you're actually going over the emotion, and for example, if I have an emotion that I cannot handle, it's overwhelming for me, and all the skills that I've ever used, I'm trying to use, it's just not working. As a cognitive therapist, how do you first assess where would you have to go with me, and what type of a conversation do you have to hear to assess where you're going to take me, and then what type of assessments are you going to teach me to assess myself? And the reason I say this, I know that in your book, Mood Over Mood, Mind Over Mood, not Mood Over Mind, not the other way. That the other way usually happens, but we're trying.
That's right.
In that book, you also have a section for depression. You have a section for anxiety. You've added these new sections, 4 sections that have to do a lot with different types of mood and emotions. So tell me, how would you assess? What is the path that you go over for assessment?
Well, it's interesting. I mean, in therapy, there's lots of things, as you know, that we assess in therapy, but if someone's doing their own assessment and reading our book, we have a couple of things that we help them with. Usually when we're having a difficult spot in our life and we're trying to sort things out and get help, we want to look at the 5 different areas. And in chapter 2 of our book, we have people do something we call understanding your problems. And we have people identify in these 5 areas. The first area are life situations. Are there certain life situations that are challenging for you right now, or that you think are contributing to the difficulties you're experiencing in your mood? The second thing is, what are the moods you're experiencing? And we've got some mood measures that people can take where they can measure symptoms that go along with depression, anxiety, anger, happiness, different, both positive and distressing moods. So the third thing is, we help people learn to identify what's going through their mind. It turns out there's certain thoughts that go with particular moods. When we're depressed, we think negative thoughts about ourselves and our life. I'm no good, it's all my fault, things aren't going to work out. But when we're anxious, we think thoughts about bad things happening. What if this happens? What if that happens? I won't be able to cope with it. And when we're angry, we think thoughts about other people. This person's hurting me. They're out to get me. So we help people learn to identify the situations that are leading to their distress, what particular moods they're experiencing, what are the thoughts that they're having that might be contributing. And then we also have people identify, what changes are you noticing in your body? Are you having trouble sleeping? Are you having changes in appetite? And then the 5th area is to look at behavior. What are you doing? Oftentimes what happens when problems start to pile up is we either withdraw, or we might turn toward other people. We have behaviors that we do, some of which may help our moods and some of which may actually make our moods worse.
Dr. Padesky, you were talking about situational issues that might create some of the depression versus, for example, if it's hormonal or if it's biological, or even versus some chronic depression because of a trauma that has happened since childhood, or the way that we were up, the upbringing that we had that had created that type of depression. How would your treatment be different for these types of depression in between?
That's actually the good news, and that's one of the things we want readers of our book to understand, is that regardless of the path that got you into depression, once you're depressed, depression is depression. Everybody who's depressed has similar thoughts, similar behaviors. So for example, when you or I or one of our viewers gets depressed, each of us is likely to have negative thoughts about ourselves, our life, and our future. Each of us is likely to experience more difficulty doing things, fatigue, avoidance of certain things during our day. And so because there's common symptoms once we get into depression, with anxiety, each of us is likely to have similar thoughts. Each of us is likely to avoid the things that make us anxious. So because there's similar patterns that happen once an emotion gets more serious, it turns out that there are similar skills we can teach people to help them overcome that and climb their way out of depression.
So what I hear from you, Dr. Padesky, is that regardless of what the causality is and where it's coming from, when the depression hits or when the anxiety hits, the symptomology and everything around it, it is so similar because now it's depression, that the way that the thought process happens and then the emotion and the behavior and the physical body reacts to it is so similar that one type of treatment, such as cognitive behavioral therapy, can deal with that depression and shift the irrational thoughts and the thoughts that are not real in a sense, shift the emotions based on that, shift some of the behaviors in order to change the mood or the thought, or sometimes change the behavior in order to restructure the new thought process and the skills that they've created. And due to this, we see that the depression minimizes regardless of the causality. Is that what I'm hearing?
That's exactly right. And while for depression we would do similar things across people, we would actually do different things for anxiety than we would do for depression. So this is why one of the challenges we had in writing Mind Over Mood is that we knew from the first edition of our book that many people with different moods, different life circumstances, even because it's been translated into 23 languages, different cultures, different day-to-day experiences, would be using this book. And so we had a challenge, because how can you write about mind over mood for people, men, women, older people, younger people, people who are in China, people who are in the United States, people who are in Iran? How can you write about moods in a way that everybody can relate to? And one of the things that we ended up doing is we structured the book so that everybody reads the first 4 chapters, which guides people through step-by-step exercises they can do to understand their problems and what's contributing to their current distress. And at the end of the 4th chapter, we ask people to identify which mood they want help with first. And then they go to a later chapter in the book where they would read about depression or anxiety or anger, guilt, shame, whatever mood is most pertinent to them. And at the end of that chapter, well, in that chapter, first of all, they're going to learn more skills particular to that mood. And then at the end of that chapter, the reader receives guidance and says, you know, if you're depressed, now go to chapter 5. If you're anxious, at the end of the anxiety chapter, it doesn't say go to the same chapter you read for depression. It sends you to different chapters which are really targeting the particular things you need to do to overcome anxiety.
So when we're talking about depression itself, what are some of the skills or steps that a person can do in order to minimize their depression from a cognitive behavioral therapy?
Sure. Typically, the first thing that's helpful to people is to learn about the link between the activities and the things they're doing during the day and their mood. And so we have some very specific worksheets people can fill out that just have them jot down a word or two each throughout the day of what they're doing, and to notice what their mood is, to rate it from 0 to 10, for example. And then we have a worksheet that has people go back over the week when they've done these ratings and ask them to look at, when was your mood better and what were you doing during those times? When was your mood worse? What were you doing during those times? And we guide them through a series of questions to help them figure out what types of activities actually, for a short period of time, lift their mood and boost their mood. And people can use this kind of information to increase activities that we know through research boost mood. So for example, when I'm depressed, if I do a small thing that accomplishes something, I get a little mood boost. If I do something pleasant like calling a friend who has a good sense of humor and talking to her on the phone, I get a small mood boost. Well, by building in these small activities throughout the day, it seems like doing something like that couldn't possibly affect depression. But it turns out it can begin to reduce our depression from a more serious level to a more medium level. So that's the first level of skills, learning for each of us personally, because it has to be a personalized treatment. It's not one size fits all. Each person will find different things that are mood boosts for them. Once they figure out and begin working on that, and their mood is improved a bit, the second step of cognitive behavior therapy for depression is to teach people to identify the negative thoughts. And there are thousands of negative thoughts that pop into our mind throughout the day when we're depressed. So we teach people how to identify these negative thoughts, and then we teach them particular skills they can use to test out these negative thoughts and learn over a number of weeks to replace negative thoughts with more balanced and adaptive thoughts that will further reduce their depression and get them closer and closer to feeling better.
And when we're talking about anxiety, as you said, that the way to deal with anxiety is different than depression. And as you said, the depression, a lot of times there are thoughts about who I am and the, let's say, badness of me, the way that I'm not maybe capable or good enough and all of that. And somehow about something in the past where I've come across a way of being which my past has that result and I didn't get to be where I want to be. So there's looking at the past and that way. And then anxiety is different types of thinking. Sometimes it's a future thinking, it's a negative future thinking kind of, the thinking is different. So let's talk about anxiety. I know you have a chapter in the new book of Mind Over Mood, which talks specifically about anxiety and assesses anxiety in a different way, and the way to treat it or create skills that alleviates it is different. So let's talk about that a bit.
Okay. With anxiety, the kinds of thinking is different, as you said. There's actually two types of thoughts that are quite common in anxiety. One is that when we are anxious, we tend to overestimate danger. So for example, if we have social anxiety and we're going to a dinner party, we overestimate the likelihood that people won't talk to us, that we will be boring, that we can't think of something to say. And we also underestimate our ability to cope, and we underestimate help resources that are going to be there. So we underestimate that if we're at a dinner party and we really can't think of anything to say, that the person sitting next to us or across from us very well will think of something to say, and they'll start a conversation and we'll be able to join in. Now, that's the type of thinking with anxiety, but there's also always a behavior as well, and with anxiety, the number one behavior is avoidance. And it turns out with anxiety, in the short run, when we avoid something that scares us, maybe we skip going to the dinner party, we get a relief. And so that's very rewarding to us. But in the long run, the more we skip the things and we stay away from the things that make us anxious, we never learn that we do have the ability to cope. We never build our ability to cope. And so actually our anxiety grows and grows and grows and gets worse. So what we do in the anxiety chapter of Mind Over Mood is two things. First, we help people construct what we call a fear ladder. And what a fear ladder is if I am anxious in social situations, I might make steps on the ladder. I might list a lot of social situations that make me anxious, and then I'll rate how scary each of those situations is and rank order them on a ladder with a not so scary situation, perhaps calling a family member and talking to them on the phone. And then each step of the ladder will get more and more frightening to us. And then what we do is we teach people skills to stay calm, stay in the situation, tolerate the anxiety, And they practice these skills on the first not so scary step of the ladder until they can do that step without much difficulty, and then they go up to the next step of the ladder and they practice their skills. So we guide people through teaching them things that they can do to help them face their fears. And over time, there's lots of evidence that as people face their fears with support and with confidence that they can cope, because they're taking things at a pace that they choose, that they can manage, that people almost universally can overcome anxieties.
Have you found, Dr. Padesky, that anxiety and depression sometimes are side by side? And if they are, for some people that first they become, or under their depression might be anxiety, or because they're anxious they get depressed. In that sort of an assessment, if someone assesses either or, then how would they first go? Would they utilize the anxiety method of treating themselves and calming themselves down, or would they look at the thought process and do some of the behaviors that the depression?
Yeah, that's really quite common, and it's one of the things that therapists ask me about the most is, what do you work on first? Since treatment is a little bit different path for depression and anxiety, what do you work on first if people have both? And what I usually recommend is that I recommend a therapist that they ask their clients, because I think clients have a lot of wisdom in this. And I always ask my clients, which bothers you the most? Or if both bother you equally as much, which one would you like to work on first? Because you get a sense that if you could get relief from that, it would make your life better. Sometimes you might choose to work on one first because it's leading to other difficulties in your life. For instance, if someone has crippling anxiety and they're no longer able to go to work, but they need to get to work to support themselves, then you might need to work on the anxiety first, or vice versa if their depression is keeping them away from work. So that's another way to do it. The other thing is that we have measurements in our book. We have a depression inventory, mind over mood depression inventory, mind over mood anxiety inventory, and people can actually measure their symptoms in both of these areas of their life and see where they get the higher score, and if they're not quite sure what they want to work on first, if it's 6 of one, half a dozen of the other, they could measure both and maybe begin to work on the one where they have the highest scores to start out.
You also have a chapter in the book about shame and guilt and anger, and you've separated those from the depression and anxiety section. When those come in, a lot of times all of those three somehow fuel into the depression mode, because sometimes we have the shame and guilt, but then it shows itself as the depression if it takes on as a mood versus just an emotion. Or many people who are not handling their anger appropriately, it turns into the depression. And what is the reason to separate them for you in the book? What is significance about these three particular emotions that you have separated them from the depression state?
Well, you make a very good point that sometimes we have chronic moods that maybe have lasted most of our life. Shame is something that often people feel from very early on in life, particularly if they've been abused or if they've done things that they feel really badly about. Each of these moods is a little bit different than depression. With anger, our focus is usually on other people and how they've hurt us or violated our rights. And we need to learn additional skills about changing perspective and seeing what our contribution might be to problems sometimes. Other times it may have to do with forgiveness, whether we actually forgive someone who has hurt us or not. We need to find a way within ourselves to let go of the vengeance that we sometimes feel when we're really angry, because that can eat away at us. With guilt and shame, that usually resolves around thoughts about something that we've done in our life. We tend to feel guilty if we feel like we have violated our own values, if we've done something really wrong that perhaps violates our moral beliefs, our spiritual beliefs. And so with guilt, we often need to, rather than forgiving someone else, learn ways to forgive ourselves. and also sometimes if we have done harm to someone else, make reparations for that. And we have guidance in the book about what kind of things you can think through that can actually help you apologize and make it up to somebody that you really have done harm to in a way that will be compassionate to them and also honest about your own awareness of what you did. Shame is a little bit different than guilt, because with shame, it's usually secretive. We maybe feel badly about something we've done or something that's happened to us, and we have a belief that if other people knew about this, they would judge us negatively. And so there's a secretiveness. So we address in the book how you can choose someone trustworthy and begin to open up and talk to somebody, whether it's a therapist or a religious person or a trusted family member or friend. Oftentimes it's hard to completely release yourself from shame until you let somebody know what it is that happened to you or what you did.
Now, when we're looking at the depression as a bigger umbrella, I'm sure that as you were going through the assessment in the book, Mind Over Mood, that we can also assess if some of the emotions are coming from shame or guilt, or some of the emotions, the feelings that are up are for anger or sadness that are coming under the umbrella of depression, because these are some of the emotions that ultimately come up, whether they're situational about something that's happening today or something that's happening and it's been there for a lifetime since childhood. One of the conversations that usually has come up about cognitive behavioral therapy versus the other kind of therapies is that it deals with present moment, it deals with today and tomorrow, and although it checks out a lot of the negative thought patterns that comes up and negative thoughts that have been built as a belief system, that sometimes it doesn't necessarily go back to where these belief systems were created. Can you explain a little bit that, for example, if someone's depression has come from the way that they were raised or a trauma that they got from childhood, and they made up some, negative belief about themselves, or due to that trauma, they just said, this is the way it is for me, and based on those belief systems that they've, created a whole life, a whole system of life for themselves where they kept creating the same negative results because that's what they believed, that they were bad somehow, and they created these and they weren't worth it or they didn't deserve it, and they created it that way or sabotaged your life in one way or another. When you work with a client this way, how do you handle not situational issues, but things that, as you say, were chronic and have been there for a long time?
Well, I think this is one of the things that is sometimes misunderstood about cognitive behavior therapy. It's not that we ignore the past or we aren't willing to talk about the past. I've worked with many people who've been abused as children or who've been highly criticized, or they've had experiences long in their past that were with bullying from other children, or even where they've done things that they felt guilty about their whole life. And of course, if these moods link back to those early childhood experiences, we're going to talk about them in therapy. I think that's really important. What is different is that because we have a here and now focus, we are also going to be talking about then how do those bullying experiences, or how does that abuse that you experienced in your childhood, how is that still affecting you today? And how does that influence the choices you make? For example, I worked with a man who had grown up in a family where there was a lot of chaos, and his parents were alcoholic, and when he would come home from school, he never knew if his parent would be sober or drunk, and if the parent was drunk, they would often hit him, and it was quite violent. And as a child, he developed a strategy of trying to be perfect to avoid this abuse. And when he came to see me, one of the presenting issues that he brought up was that he was highly perfectionistic. It was driving his family crazy, and it was also causing a lot of stress in his life because he now had 2 young children, and it's very hard to have your house run perfectly when you have 2 young children. And so he was feeling very depressed. He was feeling anxious. He was really struggling with perfectionism as well. Now, in talking about his childhood and understanding this was the origin, that was so helpful. But one of the things that we were able to talk about was how his what we call an underlying assumption. These are the assumptions that lie beneath the surface of our behavior and our moods. His underlying assumption was, if I can keep things running perfectly, then I can avoid chaos and violence. And when he realized this came from his childhood experiences, we could then look at what was different. He now was in a loving marriage, and he had 2 wonderful children. And perhaps he could let some of his perfectionism slide, and chaos wouldn't come about, and violence wouldn't come about. And so we were able to set up and do some small experiments where he practiced doing some things a little less than his comfort zone of perfection. And then he made predictions about what did he think would happen. And he did predict chaos, anger, violence. And when he let his perfection slide in these small ways, and in fact what happened were the family loosened up and relaxed a little bit. He had a little bit more time. He was able to giggle and play with his children. And in fact, the opposite of his predictions came about. And so it was in this way, I think, had we not looked at his early childhood, we wouldn't have understood where these rules came from. But what we did is we brought the rules and we brought the past and held it parallel with the present to look at, is the risk the same? Can you tolerate experimenting with something different and finding out what happens? And so we have to bring past and present together. And that's what at least I try to do as a cognitive behavioral therapist.
As you were talking also, because I've heard you in lectures and know that your style has also incorporated a lot of strength-based concept, which is
Yes.
you find the strength in the person's character, behavior, skills, and what they've done in their life, which has worked for them. And in the example you were talking about with your client, I was also hearing that piece where you look at what is it that they've created, and it has been their strengths and the skills that they have been able to create great results, and to look at that part. Can you talk a little bit about how you tune into the strengths?
Sure. One of the things that has inspired me the most over the decades as a psychologist is seeing how well people cope with so many challenges and difficulties in their life. And sometimes the clients that, to the outside world, they might think, oh, this is the most disturbed client you've worked with. For me, I see that this is the client who has the most strengths within them, because they have had a lot to deal with in their life, and they're still standing, and they're still trying and learning skills and dealing with things. I think, and I've learned and firmly believe that everybody has strengths within them, although when we are at our lowest mood, we often can't find our own strengths. And so one of the things that we've also built into our book is some of the things from what's called positive psychology. And what positive psychology is studying positive experiences and attributes that people have. So studying happiness and courage and variety, resilience, and things like that. And so rather than just focusing on negative moods, it's really important to also look at what makes you happy. What are your positive values that drive you in your life? In our book, we've incorporated, and one of the things that's in the new edition that wasn't in our first edition, which was written 20 years earlier, is our new edition includes ideas from positive psychology that have been shown to be linked to greater happiness and satisfaction in people's life. Some of these things are things like gratitude, taking a moment to think about what we're grateful for in ourselves and in other people and in our life experiences. It turns out can have a very positive effect on our mental health. But when we wrote Mind Over Mood, one of the things that we wanted to do is some of these things, they seem obvious on the surface, and yet there's been research that tells us things that are surprising. It turns out if people keep a gratitude journal, which is one of the things that we recommend in the book, it turns out if you keep a gratitude journal every day, it actually makes you feel worse. That's counterintuitive.
Yeah.
But if you keep a gratitude journal once a week, it helps you feel significantly better. So in the book, one of the things that our readers can be assured of is that we have included directions to the exercises that guide them to do these activities in ways that fit with what we know about human happiness and human improvement. So we've included things like gratitude diaries, we've included exercises in doing kind acts toward other people. I had an experience that I write about in the book where our local post office was a very unhappy place, and I needed to go there twice a week for business, and every time I went in, everybody was in a bad mood. And so I decided to practice one of the exercises from our book, and every time I would go to the post office, I would smile and be very friendly and say positive things to people. Now, the first few times I did that, people just looked at me kind of funny because it was an unhappy place and everyone was like, what is with her? But after 2 weeks, I would go in and I would be happy with the clerks. I'd say hello, and they wore name tags. So I'd say, hi Joe, how are you doing today? What's going on? It's nice to see you. Well, what happened is after 2 or 3 weeks of me doing this twice a week, when I walked into the post office, the clerks looked up and smiled and said, hi, Christine, how are you? And they smiled at me. Well, pretty soon, they were smiling and talking nicely to the people who were coming up to get service. And pretty soon, people in line started talking and smiling at each other. And it was a wonderful experiment for me because since I had to do this activity twice a week, it made it now a positive, pleasant activity rather than an unhappy experience for me. But it also showed that acts of kindness can transform our neighborhoods and the worlds in which we live. When we do kind and positive things toward other people, even if we're depressed or anxious, it has a positive effect, and then those people do kind and positive things back to us. And so one of the things that we've learned from positive psychology that has influenced the second edition of our book is that people can not just undo negative moods in their life, but they can actually create more positive moods in themselves and the people around them. And this can have a tremendous transformative effect on our day-to-day life and even on the world.
What was interesting, as you said, is that the gratitude, when it was done when it was acknowledged every day, was not necessarily changing the mood, but when it was done every week, that it was changing the mood. That's a very interesting outcome. Can you say a bit about how come that? What was the cause of that outcome?
Yeah, I don't know that we actually know.
Okay.
But we could make guesses. It may be that when you practice gratitude every day, it becomes a bit more of a chore, or we start repeating the same things over and over again. What seems to be more helpful with gratitude is it's not the number of things you think of to be grateful of or the frequency, doing it real frequently. What seems to be most effective is if you take one or two things and really think in detail about them. So if you think, I'm really grateful that I have this nice neighbor who lives next door, but instead of just saying that, okay, I'm going to put on my list, I have a nice neighbor who lives next door, if you instead think, what is so nice about living next door to her? Well, I appreciate that she tries to keep her front yard looking nice. She plants flowers. When I walk outside, she smiles and she talks to me. She seems to have a kindness in her heart, and she has a nice smile. When I think about all of those things in depth, that has a bigger effect on my mood than just making a list of a lot of things. Okay, nice neighbor, the sun was out today. Thinking about a few things in detail has a better effect on our mood than making a long list. So maybe that's one of the reasons.
As I'm hearing you, my experience with myself and with clients have also been that when something becomes a chore-like concept, it takes away from the depth of having the exercise to be done for how it was meant to be, which is pondering, experiencing, feeling, and having all of that at the same time versus having it become part of a daily chore. Where, I mean, the structure sometimes helps a lot, because if we're not thinking about it, having that type of a structure obviously allows us to come in and think about it. So if it works for people to create that structure so they can put themselves into the type of a meditative mode and looking at and really being aware and pondering and experiencing, then it works for them. But if they're just doing it as a chore that they got to do, then I can see where it won't have the same effect, because they're not utilizing it in the same way, where they're not feeling it. They're just doing it as something they got to do and let it go.
But it's interesting, because there are some things where doing it every day, even if it feels like a chore, does have a positive effect.
Such
so doing certain activities every day, even though it seems like a chore when you're depressed, actually does positively affect your mood.
Such as exercise?
You need to know what the thing is. And one of the other things I think that makes a difference is doing these exercises and having these awarenesses when they're likely to have the most impact. One of the things we've done in the new book, which I think is something that readers are going to find most valuable and therapists are going to find most valuable as well, is all of the worksheets in the book are going to be available to readers as fillable PDF forms that they can download to their phones, their tablets, to their computer, so any electronic device, so that if you're out and you're in a coffee shop and something happens and you're thinking, oh, this is the situation where I need to apply that skill, but I can't quite remember what it is, you can have it right there on your phone, and you can kind of look it up and you can fill out the information right then when it's really happening for you and you're having the emotion. I think this is going to make it much more real and have a better impact for people than 3 days later saying, oh, I've got to fill out this worksheet, what shall I pick to fill it out on? So we've really done everything we can to try to incorporate what we think is going to make it easier for people to learn these skills and to practice them at the moments of their life when they're going to be most useful to them.
Using technology to the best of it.
Exactly, yes.
And it really promotes self-awareness in that piece, because you do have a tool where at the moment you're experiencing it, you can utilize that tool and have it, and experiencing, bringing it up, writing it, releasing it, all of those also helps as such an intervention, especially when it comes from...
Absolutely, because you can say, okay, I've got it. I've got it right here. I now can look at it later. It's stored. I can save it.
Right.
I don't have to keep thinking about it if now I need to go back to something else and be in a different mood.
Yes. Well, thank you so much. Please go to Padesky.com. You can also go to mindovermood.com. Look at the book. Please purchase the book. It's redesigned. The first copy went over 1 million copies. It's been upgraded with all the new research and everything that's there just for you. It's one of the best self-helps that are out there, because as Dr. Padesky told you, you got forms, you got skills, you got tools, you got assessment tools. What type of self-help gives you assessment tools? That's awesome. You actually have assessment tools. You can assess what kind of mood you're in. Is it depression? Is it anxiety? Is it shame? Is it anger? And what are those, and where inside of you could find that. You could put it on the forms, assess yourself, and then go to the chapter that is appropriate to give you those skills, and then minimize your depression. And then it also gives you all of the other tools that positive psychology has brought up, such as gratitude, where you are in your strengths, how can you utilize them and bring them up, and put them also as a structure in your life where you can consistently shift from the moods that take over you, which you don't want them, toward the emotions and the mood that you're choosing to have and creating the structures to have them. So as you can see Dr. Padesky's name on the screen, you have Padesky.com on the screen, and you can also go to mindovermood.com and get the book, and I'm sure Amazon.com. So Dr. Padesky, thank you so much for giving me the opportunity to be with you and giving my viewers the opportunity to be with you, and hopefully I will see you more often on my show.
I hope that you do. It would be my pleasure to do so. Thank you very much for this opportunity.
Thank you. And to all of you, thank you so much for being with us, and create a wonderful, wonderful day, week, year. Just create a wonderful life for yourself. And until next week, bye-bye. سالها بود که در بین این همه تبلیغ و محصولات متفاوت به دنبال محصولی بودم که زیبایی، جوانی و تراوت رو به پوست من برگردونه. البته بدون عوارض جانبی و به طور طبیعی. تا اینکه توسط یکی از متخصصین با لسین آشنا شدم. لسین زیبایی، تراوت و جوانی رو به من برگردوند. لسین رنگ و بوی خوشی رو به زندگی من بخشید.